Hello everyone, and thanks for tuning in. It's me, Dr. Whimsy, your favorite naturopathic doctor, helping you stay healthy and hopefully doing it naturally. That is what we do here. I answer all your questions about naturopathic medicine and hopefully show you ways that you can improve your health using natural medicine. So today we're going to be talking a little bit about blood pressure, what to do naturally, what you can do from home. Obviously, we don't give medical advice or treat people via YouTube. These are just some great suggestions that we recommend for people, and obviously you need to speak to your doctor to find out if any of this protocol is right for you. But today we're going to be talking about blood pressure, how to lower blood pressure and do it naturally. And so if there's anything here that I cover that can be of help to you, then by all means you're welcome to any information I have on this video. I'm happy to share. So let's get started. High blood pressure is one of those silent medical conditions that we often don't know we have. The only way you're going to know if you have high blood pressure is if you consecutively are getting a high reading. Sometimes you may have a high reading just because you're nervous. Maybe you were nervous at the time you took the blood pressure reading. Maybe you had been extremely physically active at the time, right before the reading was taken. So we want to determine that you have high blood pressure by consistently testing high. One time testing high for high blood pressure doesn't mean you have high blood pressure. So that's the first thing. So when we make a diagnosis, of high blood pressure, it's because we're seeing consistently a high blood pressure. One test is not a diagnosis. Okay, moving on. So what constitutes high blood pressure? We're starting now to change the protocol, but basically we become concerned about a person's blood pressure once they hit 130/85. Now in the naturopathic community, some doctors have proposed that it should go lower. I think it fluctuates throughout the day, and some of the reasons why it can fluctuate is if you had a lot of physical activity, if you ate something that had a lot of salt in it and drank a bunch of water. Your blood pressure in the morning, that first reading when you wake up in the morning, is going to be probably the lowest. And the reason why your blood pressure is lowest in the morning is because usually we dump a lot of fluid at night. When we wake up in the morning and our heart starts pumping and we start moving, the body is going to want to take on more fluid because it's going to want to pump that heart and it's going to need fluid to do that. And so we wake up in the morning, we might have a glass of water, we might have a cup of coffee, we might have 2 cups of coffee, we might drink another glass of water, we might have some juice, etc., etc. Throughout the day, we're taking on more and more fluids. We're also taking on sodium and we're getting physically active. So as the day progresses, you might see a steady rise in your blood pressure. This is completely normal. At night, you may want to slow down. Your heartbeat will slow down, and the body will do what the body does because the body is wise. It will then start to dump all that water. And that is why right around 8, 9, 10 o'clock, you might start feeling like you have to use the bathroom. Maybe you get up to go to the bathroom a couple times in the night. That is the body slowing down activity, slowing down the heart, and dumping all that water. So not surprisingly, in the morning you take your blood pressure and it's beautiful, it's nice and low. So that is the natural circle of why blood pressure changes throughout the day. And that's why we really want to get a reading first thing in the morning. Now, what can pathologically cause your blood pressure to become high? So it's high in the morning, it's high at night. We're seeing a blood pressure that is above that 130/85. We don't start to get concerned usually until it's 140, 150/90. Then that is when we start saying, okay, we've got a problem here. But that border area of 130/85, most naturopaths would already start to say, okay, what is causing it? So some of the causes can be dietary. If a person is consuming too many calories, too much fluid, as we've said, there's, you're taking on a lot of water, but with calories, your body is converting those calories to fat, and fat stores water. So simply by having more fat can change your blood pressure. So we think about calories in. Simply going on a calorie restricted diet and losing weight can be extremely beneficial if you're trying to drop your blood pressure. So there's that to take into consideration. Changes, the type of food you're eating also can affect blood pressure. If you're taking in high sodium foods and low potassium foods so that the ratio of sodium to potassium is off in your body, then that can also cause an increase in blood pressure. Also, genetics plays a factor. Some people are more sensitive to salt than others, and if they take in a lot of salt, it immediately can have an impact on their blood pressure. So in addition to calorie restriction, we have to look at the diet. Is the diet high in sodium? Diets low in fiber and whole foods can also be a risk factor. Having a diet that's low in omega-3s, not eating fish, flax, chia, soy, broccoli, all of those, walnuts are rich in omega-3s. And what those do, omega-3s, is they allow plasticity. They allow the arteries to be more elastic and less rigid. So that's the reason why we want you to take the omega-3s. Other things that are a risk factor: smoking can be a risk factor, being sedentary can be a risk factor, genetics can be a risk factor. I've already talked about that. Certain people, because of their genetics, their ancestry, may be at greater risk. Age in and of itself is a risk factor. Simply growing older can be a risk factor, because as we get older, those arteries become more and more rigid and they're less able to change as pressure increases. So elasticity of the arterial walls is one of the reasons why younger people who have more elasticity, have less rigid arteries, don't have the same blood pressure problems as people who are older who may have rigid tissue. White coat syndrome is kind of an interesting one I put here. I don't usually wear a white coat. I do it at my other job, but not here, and I still get white coat syndrome here in the office. Kidney disease, people who have certain types of kidney disease, and also tumors, early detection of tumors. If you have an extremely high blood pressure, one of the things and it seems to come out of nowhere, the first thing that we might think about is looking at kidneys. All right, so what do we do naturally? What are some of the natural things that we can do to reduce blood pressure? Well, calorie restriction, believe it or not, particularly in an overweight or obese patient, is something we want to talk about. Simply reducing calories. In general, reducing calorie consumption is associated with better health overall. Many chronic diseases can be alleviated simply by being on a calorie restricted diet. It's one of the first things that I talk to my patients about, is learning to simply consume less food. We are, for whatever reason in this culture, under the mistaken impression that we need far more calories than we actually do. I struggle with it too. I love food. People are always surprised to hear that. I love food. I love good tasting food. And so, like all human beings, it's a weak spot for me. So we want to talk about calorie restriction. We also want to talk about the type of foods that you're consuming. I'll leave a list below of what are called the superfoods. Hopefully that'll get you started. The foods that are associated with being high in potassium, right? A high potassium diet is going to be mostly those nutrient-dense foods that are going to be on that list. So we're thinking green leafy vegetables are high in potassium. Coconut water, believe it or not, is high in potassium. 1 cup of coconut water has close to 600 milligrams. So there are foods rich in potassium. So reducing sodium in the diet and increasing consumption of potassium is one of the things we do. So again, calorie restriction, consuming more potassium-rich foods, which means superfoods, fruits, nuts, seeds, vegetables, reducing sodium in the diet, natural weight loss, which would accompany the calorie restriction, and physical activity, being physically active, out there moving. Some of the foods associated, as I said, I'll link below, but celery, garlic, and onions, all those foods basically the plant-based foods are helpful. Reducing caffeine consumption has also been helpful. Caffeine is associated with sometimes an increase of about 5 points on a blood pressure reading. 5 points, give or take, systolic and diastolic both. That's the first number and the second number. The first number is your systolic, the second is your diastolic, and those numbers tend to drop by about 5 points. So if you're right there on the border and you simply give up caffeine, that in and of itself might take you to the goal number. But if that doesn't do the trick, try calorie restriction, physical activity, being on the DASH diet, which is the low sodium diet. The low sodium diet is 2,000 milligrams or less of total sodium a day. And there are some supplements that seem to be helpful. Taking arginine, there's been some research on arginine. If you've had a past history of herpes, you may not be a good candidate for arginine therapy because it can cause a herpes outbreak. It's been associated with herpes outbreaks. A B6 complex, believe it or not, because stress is one of the risk factors also that I didn't talk about that's associated. So if it's stress related or stress induced, B6 complex seems to be helpful because that can impact mood and decrease stress. And there's been some studies on CoQ10. Usually doctors will give about 100 milligrams a day. Some doctors feel that ubiquinone is or ubiquinol is more bioavailable than a ubiquinone, but quite frankly, I haven't seen enough data to convince me of that. I'll put all the links and information below to what constitutes a DASH diet, what the foods are that are associated with lowering blood pressure, or what we call the potassium-rich foods, and everything else that I've talked about here today. I'll go ahead and put it underneath this video. All right, I hope that helped get you started and encouraged you to find a naturopathic doctor in your area. To find a naturopathic doctor in your area, one that's gone to medical school and is licensed to practice, you can go to the American Association of Naturopathic Physicians, and they'll be more than happy to help you find a great physician. Okay, thanks for watching. Be sure and share, like, subscribe, and tell me what you're doing to take care of yourself. I'd love to know. Take care. Bye-bye.